Hi, I'm Dr. Steve Rasner. I'm a general practitioner for the past 30 years, and I'm here today to talk about an upcoming article I have for Dentistry Today, appearing in January 2010, called the Pontic Site Enhancement. But what's available today that a lot of us take for granted is the amazing amount of education that's afforded to us as GPs. Everything that I share with you in this upcoming article, which is basically periodontal plastic procedures, was taught to me after dental school by a number of clinicians that are known to many of you reading and listening right now. The second outcome that occurred to me after I wrote this article was how much reading this underscored the importance of bone grafting at the time we extract teeth. Because I don't know if it's apparent to everyone, but 25% of the facial palatal width of the teeth in the aesthetic zone, the anterior part of our maxilla mandible, is lost in the first 12 months. And up to 40% is lost in 3 years. And that rate and ratio could be greatly diminished if we would graft simply at the time of extraction. There's going to be times, just like with the patients that I introduced to you in this article, a 60-year-old female and a 40-year-old male who had deficient Pontic site areas and wanted fixed bridge work. So what I've done is I reviewed a augmentation procedure that was introduced 45 years ago. And actually there's several soft tissue augmentation procedures available, but the two that have received the most attention in the literature would be the subepithelial connective tissue graft and the onlay free gingival graft. And I go into great detail with 2 patients on how I interchanged both of these procedures. We start out the article by talking about the classification of defects, of soft tissue defects, that was introduced by J. Siebert back in the early 80s. We talk about a class 1 defect where the patient has a deficient buccal palatal dimension. We talk about a class 2 defect where there's a vertical loss of tissue. You're going to address these different ways. And then there's a class 3 defect where both dimensions are affected. The first patient we visit in this article is a 61-year-old white female. And she had worn a partial denture for 20 years. Presented to my office, wanted fixed bridge work. She was missing teeth numbers 7 and 8, upper right, lateral, and central incisors. She had a buccal lingual deficiency in her soft tissue. So let's think about what our options would have been prior to periodontal plastic procedure. The options would have been a ridge-lapped Pontic, which lends itself to poor hygiene and, quite frankly, not great aesthetics. So the patient had a choice of allowing me to do periodontal plastic surgery to just literally build up her ridge. And so we took her through multiple procedures, 2, where we did subepithelial connective tissue grafts. And the outcome, as you'll see in the article, is pretty amazing, pretty impressive. Not ridge-lap Pontics, but ovate Pontic sites that look like they emerge from the tissue and look like natural teeth. So throughout the article, I go into details that I think are required for success for you. The second procedure is even more interesting to me because when you'll see, the pictures are pretty lucid, and you're going to see a giant vertical defect that I was able to augment about 4 to 5 millimeters. I think what the article underscores for me is the importance of all of us putting a little extra time and thought into immediate socket grafting when we're extracting teeth. Because the truth of the matter is the best procedure for this would be not to have to augment tissue. You know, it's 2010, and the bar is out there, and we owe it to our patients to offer them these procedures that are predictable, they're learnable by any of us in a number of arenas, whether it's Sonic or Mish or Mike Picos in Florida. There's a lot of people that are capable of taking the GP to the next level and sharing with them the ability to augment tissue.